you this evening?
I'm good. How are you?
I'm fantastic. Thank you. Welcome back. We love hearing your perspective as a psychologist and therapist working in the cancer space. And I want to really dive into a question that I get asked a lot, which is really talking about mental health and well-being strategies in the face of cancer. You know, our viewers are predominantly diagnosed with a disease such as ovarian cancer or gynecological cancers. And I know that everybody's really different in what their needs are. I'd love to hear your perspective on some mental health strategies at different maybe time points during a diagnosis or treatment, and just kind of some things that people can engage in and directions to take from your perspective.
Sure. So I think that what I've learned over the years is that people's experiences and needs are frequently pretty different as their progression through cancer moves on. When someone is initially diagnosed, there's frequently a fair amount of shock, and some degree perhaps of fear or maybe even a little bit of grief. Um, but also there's a lot to do when someone is
Mhm.
initially diagnosed. You know, you have a lot of doctor's appointments, you have a lot of questions to get answered. You're frequently moving pretty quickly in those early stages. And so you may not be processing a lot emotionally because there's just not space for that. And I think also because some people feel like if they let themselves do that, they're going to fall apart and they can't handle falling apart. There's too much to do. So, you know, in early treatment, there's a lot of tasks. And even during active treatment, you know, depending on whether or not you're doing chemo or radiation, surgical recovery, like there's a lot medically going on. Frequently, you're just exhausted. You know, and that can be a time where some of the social pieces get really difficult. You know, because people really want to help, and you may be too worn out to tell them what help you need. Also, there's this layer with, you know, ovarian or gynecological cancers. Some of what is happening treatment wise is happening in places in your body that you don't necessarily chit chat with the ladies at church about. And so being able to be like frank about how much radiation hurts or how complicated things like going to the bathroom may be for a little while, like there aren't a lot of spaces where we make those conversations acceptable and welcome. And so it can
Mhm.
feel pretty lonely going through
Right.
active treatment. It's where other cancer patients and survivors can be a huge resource. Um, I see the most people in my office when they are done with active treatment.
Mhm.
Because at that point, lots of the folks in their lives feel like, oh, you're done. You know, you have crossed the cancer finish line. We're good.
Mhm.
And
Yep.
a lot of people in their lives want them to be good at that point. And there's less room to be sad or scared or furious that this happened because this wasn't part of my plan, and it's not fair. And so that tends to be the time, you know, I see folks at every stage along the way, but I would say the highest percentage come to me after treatment because they don't feel as good as everyone seems to think they should feel.
Right. And I think we've talked on and off kind of in conjunction with that last sentence of sort of this guilt, this survivor guilt, not just that I lived and somebody didn't, but also like I don't feel like everybody expects for me, both physically and mentally. Can you talk a little bit more about that piece and maybe some strategies for communication or what to do?
Sure. So I think it's not just survivor guilt, although survivor guilt is really tough, especially if you know folks who have died from cancer, then to be living with cancer or living after cancer can have some emotional complications. But I think actually some of the guilt that I see even more of is that cancer is really hard on your body. The things that we do medically to stop cancer from hurting you more also hurt, and chemo and radiation, even surgical procedures, they do a number on your body. And so people who are accustomed to being busy and productive and, kind of like a get it done person, they cannot always get it done in the way that they used to. And that means that either there are some things that aren't getting done, or other people in their lives are having to get them done instead. Like there's some responsibility sharing, and a lot of the folks that I see are struggling with some real guilt around that. Guilt that they can't do everything that they did pre-treatment.
Right. Right. And I think it's really important for people, obviously, to acknowledge. I know as a therapist, you provide a lot of strategies and just sort of resources. Do you have any kind of high level things? I realize a lot of this is individual, but any high level recommendations for people kind of as just a starting point?
Sure. So I think one of the tools that I encourage people to really take advantage of is to be honest with someone, with themselves, with a journal, with a therapist, with a really trusted friend, to be honest about what they are actually feeling. Because sometimes living with cancer, having been diagnosed with cancer, going through cancer treatment, it's just hard. It hurts. It's scary. And so things that you might naturally feel are sad and scared and mad. And they need some place to be able to feel those things and let that be what they feel. Because so often people who really love us struggle with seeing us in pain. And so when we say, I'm sad, I'm scared, I'm furious, they try and talk us out of it or cheer us up or point out the silver lining. And all of that's done from a totally loving place. And if you're in that moment and that is your feeling, having someone try and replace it with a different, more acceptable feeling is not terribly helpful, actually.
No.
So, that first tool is have somewhere or someone that gives you permission to be totally honest about what you feel.
I love that. And you've also mentioned, and I think one of the other practical tips I'd like to wrap up with is the one about being in the moment and connecting with your senses. Can you talk about that for
Sure.
our viewers?
So sometimes when you're feeling big feelings, I mean, I understand I just said feel all those feelings. Also, sometimes you have to drive your car or, interact with a kiddo who needs homework help or do some work. So sometimes when you're feeling big feelings, it sets your brain racing. And especially if it's like the mad or the scared feelings, there's this whole cascade of this and then this and then this and then this. And a lot of that is very future oriented. And so it can be really helpful in order to be able to function in a given moment, to be able to put yourself back in that moment. Because really our only power is in our present moment. Like this is where we get to do things that make a difference. The past is gone, the future is not here yet. Like we only get right now. And so one of the tools that I work through with clients is to recognize that an excellent way to connect to the present is to use your senses. So to identify something that I can see right now, something that I can smell right now, something that I can taste right now, something that I can touch right now, something that I can hear right now. And I like that particular tool because it is very effective at getting us all the way back into our bodies, which is a great way to get to the present moment. But also there's no equipment required, right? Like you can do this in
Right.
your car at a stop sign. You can do it at your desk and I guess nobody has cubicle neighbors anymore, but if you did, you wouldn't notice. It's very accessible. You don't need preparation or equipment or anything else. You just need to recognize that you have these 5 senses and connect with them.
I love that. That's so helpful. Thank you so much, Dr. Ann, for all of these really practical and much needed tips. We really appreciate having you. I hope you have a great rest of your night.
You too.
Thank you.